guys, this is Dr. Ellie, and I'm here with my podcast, I Heal Kids, and I see kids ages 0 to 21 for holistic pediatrics at my practice, Middle Path Integrative Pediatrics in Asheville, North Carolina. And I also do functional medicine for ages 2 to 102. If you don't know what that is, please go to my other podcast because I have tons of pods on functional medicine. And I am so excited today because I am here with Mr. David, who is a pediatric acupuncturist and also adult acupuncturist and who practices traditional Chinese medicine. David has actually been practicing acupuncture and herbs for 18 years, you guys. He's been seeing a wide variety of issues in children of all ages. He's trained in the US, he's trained in China, he's trained in South Korea, and he brings just a massive amount of experience to his practice and teaching. He's based in the San Diego area, and like I said, sees kids in person and via telehealth, which I'm super interested to ask you about the telehealth aspect of your practice. So welcome, David.
Hi, thank you.
So I was kind of fascinated by your story. So when I was kind of looking over like your website and all of that stuff, it seemed like you had spent some time at the Children's Hospital before launching your private practice. Is that right?
Well, so I teach at the college. So the biggest acupuncture college in the nation is actually here in San Diego.
Okay.
And one of the programs that we run is we take students over to Rady's Children's Hospital. We
Okay.
work in both the inpatient and the outpatient. So inpatient oncology and GI, and then outpatient is the chronic pain department. So what
Okay.
I did was I was supervising over there for a couple of years, taking students there, and then the students will have patients. So the parents will request acupuncture. Then the doctor will approve it, and then we'll get an order to go over to whichever room or to the outpatient area, and then we'll do acupuncture on the kids. And then what'll happen is the students will do the assessment, talk to the parents, talk to the child, find out what's going on, and then I'll come over and assess with them or get a little rundown from the student, and then I'll tell them, okay, here's what I think you should do, and then the student does that. And sometimes I'll just hang out and do the treatment for the student if they're not sure what to do.
Well, that's fascinating. So I didn't realize that you also had acupuncture students working with you. That's really amazing. That's such a great training program. So are these patients like are they children who are hospitalized sadly for things like cancer or have had surgeries, or are there other things that you treat as well inpatient?
Over there at the inpatient, it was mostly the oncology floor that we were on.
Okay.
But we were also actually in the pediatric ICU, the cardiac ICU, and the NICU as well, and some of the surgery wards. So they were all pretty centralized in one area. So we would take the students down into different areas and we would get to see a really wide range of things. I mean, from very serious, cancer cases to seizure cases to, post-surgery of all different things, spinal surgeries, GI surgeries. So kids in recovery, that kind of thing. And then the outpatient program was actually the chronic pain department.
Okay.
So that
Okay.
was inevitably after some number of years of being there, inevitably it always seemed like it turned into this very select population of like tween age girls with
Yeah.
vague abdominal pain
Yeah.
that nobody could figure. They had done all the things and they couldn't figure out what it was. And then just finally it was the chronic pain department. And then so we would end up working with them to try to figure that out. Which is actually
Yeah.
something that acupuncture excels at looking at,
Mhm.
is
Mhm.
vague pain that nobody can figure out. That's kinda where acupuncture really finds its feet.
Yeah. I often find myself referring for that. I also love that you worked in the NICU. I just want to kind of pick that out because I think a lot of parents sometimes think like either their child is too little or too young to see someone who does Chinese medicine or acupuncture.
Yeah.
Yeah. So just point to kind of put a like fine point on that. Like you can treat babies too.
I get kids coming in. The
Yeah.
youngest kid I ever treated was 1 day old, and, the baby had failure to defecate in the first 24 hours. So they hadn't passed yet. So they brought the baby in, and the baby was in a lot of discomfort. And then so I started doing the acupuncture right there in the room on a 1 day old, and the pain started to increase, and the baby started to cry more and more and more. And then all of a sudden, right in the room, boom, the just full on bowel movement. And it was huge, and it was the whole thing. What
And
was funny about
everyone's cheering, right? You're
Oh, it
like,
was great. It
yay.
was the best moment of my
Yeah.
life. And then what was funny about it was then they would come in for the next couple of weeks, they would come in once a week when the baby would kinda start to build up again,
Yeah.
and then we'd do the treatment, and it was like clockwork. Every time they came in, the baby would start to get more and more, fussy and start crying and crying and crying, and then boom, bowel movement right there in the room. So, yeah, that happened like 3 times in a row. So finally we got on top of that, and then she started having more regular bowel movements, and now that kid is like 16. I mean, this was a long time ago. So,
Wow, that's
yeah,
great. Yeah, because that's such a common that is actually like a super common issue. Like, more and more kids are constipated, more and more kids are having belly pain. I mean, the way that our don't get me started on our nutrition because we'll be talking until next
sure.
tomorrow. So. Well, okay, so you're teaching, you're doing the inpatient, you're doing the outpatient, and then do you also have your own clinic or did I misunderstand that?
No, I do. So I've been running a
Okay.
private practice for about 18 years now.
Okay, that's what I thought. Okay, so
Yeah.
how did you end up how did you evolve, like it just seems like so much. I'm like, "How is he doing all this?" And, how did this inform, like, your decision to have a clinic? How does it compare and contrast to, like, inpatient work?
Well, I got very lucky at the very beginning of my schooling process, actually. The very first teacher for the most basic Chinese medicine class, the person that taught that class, he was amazing. Like, and I just
Okay,
the minute I met him, I just fell in love. I was like, this is my guy. Like, this person
okay.
is going to be my mentor.
Yeah,
And I've sort of collected mentors over the years, just sort of accidentally. But it turned out that he was a pediatric specialist.
okay,
But that's what
yeah.
he was doing. So I just sort of fell into it because then what I did was I was like, I want to be around this guy, but he's busy. So what I did was I went to him and I said, look, I promise, I commit to coming to your clinic once a week for the rest of this term let's figure out a day. I will be there every week and you just put me to work. You don't have to teach me anything. I don't care. I just want to hang out. And he was like, all right, cool. So then I did that for 4 years with
That's
him.
super cool. That's
Yeah.
super cool.
And yeah, so we became close, really good friends. And actually at the end of the schooling, he moved out to the Asheville area. So I went out and visited him out there.
Really? He's
Yeah,
out here?
he
What is he
was. Yeah, he
doing?
passed away,
Is
but
he
it was
oh,
in
oh, well,
Alexander, was that this town? A little bit
yeah,
outside of, yeah, a little bit outside of
yeah.
Asheville. But so
Wow,
I've
what
been
a
out there to
small
visit.
world.
Yeah.
That's crazy. Your
So I
mentor was right here. Okay, I'm just wrapping my head around that.
So I
Okay,
fell in with him, and then so sort of by osmosis and just by generally being annoying and just asking tons and tons of questions for over the course of 4 years, I learned a lot about kids. In fact, what it was he would see 15 patients a day in a 6-hour period, so 3 per hour. And in that grouping of patients, maybe 2 or 3 would be kids.
okay. That's quite a
And
lot
then
for for an
no,
acupuncture
it was.
practice.
It was
Yeah,
considered a
yeah.
lot. So, I mean, he was the specialist, right? So, what would happen was with the adult patients that he would bring in, I would just go in, pull needles, turn the room, and do a bit of massage and stuff. But they were like relaxing. They were having a nice experience. So I wasn't like trying to bug them and talk to them and stuff like that. Whereas with the kids, he would tell me what treatment to do for them.
Okay,
So then I would go in and do the treatment for them, which meant that I was hanging out with them for about 15 minutes and then we'd just be chatting with the parents, hanging out with the kids and all that. So that was like kind of the highlight of my day because I would get to learn about the case because the parents were fine if I asked them questions like, what's going on here with the constipated? They would tell me all the info. So then I would come back out when they were done. I'd be like, wait, I didn't understand why we did these points for that particular ailment or something. Then he would explain it to me. So just because of that circumstance, I learned more about children than I did about adults over the course of 4 years.
yeah.
So that's what happened to me, and then after I graduated, I opened my own private practice, I was working, and then I came back to the school that I graduated from a few years later and started teaching, and then I ended up teaching his class, the pediatrics class, I ended up teaching his class, the introduction to Chinese medicine class, so I kinda stepped into his life a little bit. And then part of that too was picking up different things, so I was supervising at Rady's as well, and so I was doing a fairly broad swath, but I didn't get into this with a specific passion for kids.
Yeah.
It just came
It
about
snuck
because
up on you.
yeah, because hanging out with kids was like the highlight of my day,
Yeah, yeah.
working with him, so it just got to be the most fun, and then I just stuck with it.
Yeah. I have a similar experience to you around that. For people that don't know, when you're in medical school, the first 2 years you're doing like a lot of books, like a lot of book work and labs and, things like that. That's where you hear about like dissecting people and yeah, all that kind of scary stuff. And then the second 2 years, you start rotating through like the main specialties. So like OBGYN or pediatrics, surgery, whatever. And then finally after that, you'll specialize. And so I was in those second 2 years and I was like, my goodness, I don't like any of this. This is not for me. What am I gonna do? I'm in my 3rd year of medical school. I'm like, okay, I don't want to be an OBGYN. I'm surgery. I get lightheaded, And finally, I ended up in this pediatric clinic with this guy, and he was just amazing. He was in Kansas City. I'll have to see if he's still around. He had this he served underserved communities in the city, and he had like a beautiful developmental program. And I was just like, yes, like this is my person. And he was like so happy and so cheerful, and the kids were so great. And I was like, I found it. Thank heavens. Because if not, I don't know what I would have done. Maybe I would have gone back and like studied singing again because I was a vocal performance major back in the day. But it was an interesting time, and then just kind of fell into it and was like, oh, okay, I found my place in this world. So it's interesting how those mentors can really just
It's been key to my life.
yeah. Yeah, they can just, like, influence you. So, okay, so I just need to back up because not everyone even knows, like, what traditional Chinese medicine is. Like, what are the tenets of it, and what should parents know? Is it the same as acupuncture? Is it different? Is acupuncture part of it? Tell us
Sure, sure.
everything.
So
Yeah.
probably the biggest sort of challenge that I experience around all of this is that everybody's sort of familiar with acupuncture for pain, right? So sports medicine,
Yes.
orthopedics, my knee hurts and my shoulder hurts and then my back hurts, I'm gonna go get acupuncture. But that's
Migraine.
only one small portion of what acupuncture does. So that's kind of considered almost a specialty, right? So I treat a lot of sports medicine, a lot of knee injuries and stuff, runners and the like. But there's a whole other part of what we consider acupuncture and herbs in Chinese medicine, which has to do with internal medicine, right?
Okay.
Of course.
Tell us more.
So internal medicine is considered digestion and immune function and respiratory stuff and all of these developmental issues and all of these things that are happening inside the body that don't have to do with pain, basically. This is what,
Okay.
in a sense, what we consider this internal medicine question. And that really is my specialty, is what I would consider internal medicine. Whether I'm treating adults or kids, I am most interested in thinking about treating sleep, treating your digestion,
Fascinating.
treating moods,
Yes.
treating these kind of and this is something that Chinese medicine is slowly making its way into the wider culture as far as this internal medicine question. So that by far is the biggest challenge for me, is getting parents, getting everybody on the same page as far as like, oh no, this isn't just for Seaver syndrome or something like that. Like, you're going to
Yeah.
come in with Osgood Schlatters and growing pains and that kind of thing, which we treat quite well. And I was treating 7 girls on the same field hockey team that all had either one of those two knee pains or yeah, it was a lot of them because they just kept coming in.
Okay.
They were all running on hard grass fields and just, um,
Okay.
so
I was
we
like,
were
what are they
treating that.
doing? Maybe they need to revamp their training program.
Well, it may be. I mean, those kids
Yeah,
may have
yeah.
been overtrained. So
First time parents, you are getting bombarded with information and advice from everyone, from blogs, from families, from strangers, and you do not need any more noise. You need clarity. And so I am a holistic pediatrician with 17 years of experience, going on 18, with evidence based holistic guidance you can trust. So if you need to know how to feed your baby at any point, whether it's starting solids, starting breastfeeding, starting formula, enroll in my course today, Nourish with Confidence, and give yourself peace of mind. The link is in the bio. Wishing you well, guys.
but yeah, so this internal medicine question then, so because whether it's, newborns or infants or, kids all the way up through 15, 16, in that range, it's my interest in this situation are these broader questions of, okay, let's say they have a little pain, but how is everything else going? Is appetite good? Is digestion good? Is immunity good? Is everything tip top, right? And then even when we're talking about, okay, so they come in for digestive issues. Every time my child eats, they get kind of bloated and then they complain of stomach pain. Oh,
Hmm.
mama, my tummy hurts. And then we don't know where it's coming from. Okay, so we treat that. So maybe we need to treat strengthening their digestive system. Stomach acid levels maybe are low, or maybe pancreatic enzyme function is a little low, it's just lagging behind in development, and so or maybe the food they're eating just isn't agreeing with them or something, so we need to work on having their digestion strengthen. So then
Yes.
whatever they are eating, then they start to digest that. Or maybe their tummy hurts because of stress that they carry.
Mhm. Mhm.
Maybe that's affecting the system, and so by reducing stress and calming the nervous system, then the digestion works better, and it kinda takes the pressure off the digestive system. So
Mhm.
this is the sort of quote unquote "internal medicine" aspect of it, which is the investigative work. You
Yes.
know, 2 kids come in with tummy pain, but how do we suss out whether it's a weakness of the digestive system or an overarching stress issue or maybe both?
Mhm.
And so then that's
Mhm.
gonna inform how we treat, the kinds of herbs we're gonna pick. That'll inform the kind of acupuncture points we wanna use. And that'll also inform then for me, which is then the larger question, because they could come in with tummy pain, but I expect to get on top of that fairly quickly. Within a few weeks to a month, I expect that to be resolved. That would be
Okay.
typical. But then
Okay.
my thing is starts to be this even larger question, this more general question we're saying, especially if the kid is stressed, then I wanna have this even larger conversation where we're saying, What's the stress situation here? What's causing that stress situation? Is it a parenting question? Is it a physiological question in the sense of how they were born, in the sense of like, because anyone that has 2 kids, you always notice that one of them is sort of I hate to say this, but the quote unquote kind of easy one. And then the other one is typically more kind of the tough one, you know? And then the parents are always in this position of being like, what did we do what happened with the tough one? Why is the tough one so tough? What's going on there? In Chinese medicine's conception of that, we would say actually the child was born that way, that these
Hmm.
are different
Okay.
personality structures,
Got it.
right? So one personality structure is very sweet, easygoing, tends to be very compliant. Okay, mama, no problem, whatever you say, right? They're very nurturing, very sweet. I love you, mama, like just, volunteering their affection and their sweetness, right?
Yes.
So that might be one personality structure. And so they have their positives, but they also have their challenges. They may tend to worry a bit. They may tend
Mhm.
towards a little bit of anxiety, social situations, maybe some shyness, that kind of stuff. So, what my larger question here is, what my larger interest is in looking at that personality structure and saying, are they developing in a healthy way within that personality structure? Because then say you take a kid who's quote unquote the tough kid, right? The one that's a little
Huh?
bit harder, that requires a bit more strategizing around the parenting.
Yes.
Then in that case, we're saying, okay, on the one hand, the kids who are more, again, the labels, difficult, quote unquote, then we're saying, okay, what is it about them that's inherent to their personality that they were born with that makes them sort of that way? And what we would
Okay.
say, what Chinese medicine would say, is that they have a personality structure that allows them to sort of see into the future and to move towards that future to something they want to achieve.
Okay.
So in the adult world, this is like CEOs, this is like philosophers, this could be, anyone who's kind of pioneering some
Yeah.
field in any sense of the word. Right? So this could be leadership qualities. This is the ability to be like, did you know that there's people out there that don't have clean drinking water? We should do something about that. And they go and
Right.
fundraise and they go and do the whole thing. They saw into the future and they want to move towards that and take everyone with them and make the world a better place. So they're like,
Uh-huh.
I always think of these kids as like the agenda kids. They always got some agenda, and they just want to move towards that agenda. So that's great. That's like their best qualities. They're really good with people. They're really good at understanding people. They're good at working with people, understanding other people's needs and how to address those things, and problem solving. That's their big thing. They love problem solving. So when they're kids, they just want to do everything all the time. Even
Huh?
things that are not appropriate for their age, like, you could be working with like a really sharp knife cutting and they're like, I want to do that. Or you could be working with complex machinery and they'll be like, I can do that. I want to, like, well, hold on. So, but then the
You're
flip
like
side,
you're 4 years old.
yeah,
Let's wait a
hold
minute.
on. They have this funny kind of confidence around that kind of stuff that they just shouldn't have, but they do. They're great kids. But the flip side of that is then because they're good at looking towards the future and because they have that inbuilt desire to move towards that future, then it's easy for them to get tripped up by roadblocks,
Okay.
by things that are blocking them. So the issue for these kids tends to be more like frustration issues,
Hmm.
anger issues, irritability, right? So kind of a short fuse situation. And so what we're looking at then is two sides of the same coin, two sides of the same personality. So what we would argue in Chinese medicine is that this child is born this way. But the question is, how healthy are they in their type?
Okay.
So are they more on the problem solving, figuring out how things are going, how to move forward on what they want to do and all that? Are they positive minded? Are they feeling self-confident, all these things? Or are they more often frustrated, anger issues, lack of self-confidence, poor self-talk? When they talk about themselves, they talk about like they talk down about themselves in a sense.
Hmm.
Which side are they showing more? Which side is becoming more dominant? So in that sense, then what I'm trying to assess is how healthy are they sort of almost in their type? In their
Okay.
type of personality, are they healthy in that situation or are they not healthy in that situation? Because the reason that's so important to me is because then that is what's going to set the stage for the rest of their lives.
Hmm.
That's going to set the
And do you
stage for
find,
everything.
sorry to interrupt you, I was just going to ask, do you find that this ebbs and flows though? Like I find in health, oftentimes we're in and out of balance, like over in different seasons, in different
Mhm.
growth phases or different
Sure.
kind of regressions or in pediatrics developmentally. So like with each, maybe there's a growth spurt or, it's puberty and so we're hormonal, all of these different things. Like, do you find that there's some flow that could still be considered quote unquote normal, but isn't necessarily outside of balance, but it's more just a river, I guess,
Sure.
for lack
I
of a
mean,
better word? Yeah.
we all survive on that kind of grace, don't we? Like,
Yeah.
that it's okay that everything goes up and down. Yeah,
Yeah. Yeah.
certainly. But
Okay.
so the way that we would look at it is we would say that health, a good way to define health from a Chinese medicine perspective is really resilience.
I love that so
Right.
much.
Yeah,
Okay.
because it's like, if you have a strong digestive system, then it's okay to eat a McDonald's hamburger every once in a while. It's not gonna make you sick. You're gonna feel
Hmm.
fine afterwards. It's a little treat that whatever it is for you, that's your little thing. Or if you travel and you eat weird food in a strange place, that your digestion is strong enough to just sort of digest those bacteria and not have them be a problem. You could eat some, you know what I mean? That's
Yeah.
that's resilience. And that's the ability when your digestion is strong, then you could eat weird stuff and it's not going to blow you out of the water every
Yeah. Yeah.
once in a
Yeah.
while, right? But if the digestion is
Right.
weak, then every little thing you eat, it's going to be a problem,
Okay. So we're
right?
looking for the body to be resilient in mind, body, and spirit
Yeah,
so
yeah,
that we can adjust to the changes in environment or stressors, internal or
sure, sure.
external, and maintain a sense of like homeostasis or balance so that we're coming back into range and we're not going further and further and further over into left field for all
Yeah,
those
so
baseball fans out there.
for these kids who
Yeah.
are kind of the more frustrated types, then yeah, there's gonna be a million things every day that are potentially gonna throw them off. And so
Yes.
what I wanna see is that sort of that threshold for falling into a stressful state, like almost kind of falling into that sympathetic nervous system state, that threshold is fairly high. So they can put up with a fair amount of not getting what they want before they flip out, you
Okay.
know? So, right, so they're sort of have that built up there. So they're pretty easy in that sense. Then when they do finally flip out about something, that it's not such a big flip out.
Yeah.
And then when they do flip out, that they resolve more quickly,
Hmm.
right? So, like, for example, when I'm treating these kids, that sets part of the baseline for how I'm measuring progress.
Okay.
And
So
yeah,
are you noticing that they are able to emotionally regulate better during the treatment or how do you ascertain that piece?
I describe all of these things exactly the way that I describe them to you. Essentially, this is how I tell the parents, look, this is what I'm looking for. So what we do is the parent comes in, and you were talking about like a telehealth situation. So the same thing applies in that situation. We're just talking on the computer. What I'm doing is I'm asking a series of questions. What's going on here?
Okay.
Right. And what the parents don't realize, and what they always walk away surprised about, is that what I consider to be related issues is typically much broader than they expect. Right. Cause like they come in and they say, like, tummy hurts. And then I'm asking about stress. I'm asking about a bunch of different things. And they're like, oh, I didn't realize that these things impinge upon this, that these things are related to that somehow. So then, so if the kid comes out and they're a stressed out kid, I'm asking about sleep. I'm asking about digestion. I'm asking all of these questions. And then for me, basically, I say, look, every single question that I've asked here that you've answered sort of positively to, in a sense, like had an answer for, like, oh yeah, sleep is a little funny. She tends to wake up a lot at night. He's a very active sleeper. He talks in his sleep. He's sweating at night, running hot. All indications that the nervous system isn't sort of relaxing. He's not falling into that deep sleep state. His temperature's going up rather than down, which is just a mirror for kind of how his day looks. The nervous
Okay.
system is just ramped up during the day all day. Well, it's no surprise that in a lot of these kids, the nervous system stays ramped up at night, and they just don't.
Mhm.
So they're working out their stress at night and having argumentative dreams and stuff. So then I say, look, these are all of these things that we've talked about are all related things. So even if the main complaint is not getting along with their sibling, like that's just the one thing that's driving the family crazy. Even if
Yeah.
that doesn't necessarily improve right away, if all of these other things around it seem to start to improve, then I would say, "Oh, no, we're on our way. We're gonna get there."
Yeah.
It
Yeah,
doesn't
this is
usually
sort of
work like that. I mean, usually we get everything kind of improves globally, typically.
So, for those of you listening, we are not done yet. In episode 2, David and I are actually going to be diving deeper into how we bridge the gap between Eastern and Western medicine by developing a common language in pediatric care. We're also going to explore how the stress responses in children affect growth and development, and also ways to understand parenting styles and family systems through energetic lens. If you want to also listen further, we're going to talk about like gentle, non-confrontational ways to redirect behavior and how the gut-brain connection and herbal formulas can play a powerful role in supporting kids' overall well-being. So make sure you subscribe or follow I Heal Kids wherever you're listening to the podcast. And again, I am Dr. Ellie, and this is I Heal Kids. Thank you for listening, and I'll see you in episode 2.